wondered why some patients receive better care than others, even in the same healthcare system? Well, the answer lies in a troubling issue, medical biases. And in today's video, we're going to explore medical biases, why they persist, what steps we can take to create a more equitable healthcare system. Hi, my name is Tanisha Campbell, and through training and workshops, I guide healthcare organizations in addressing implicit bias and promoting health equity. And today I'm discussing a critical topic for every healthcare provider, medical biases. And we will discuss how these biases affect care, how we can tackle them, and why it's urgent that we do so. Now, medical biases are ingrained in our healthcare system, showing up in everything from patient-provider interactions to the policies that shape our healthcare delivery. And these biases disproportionately affect marginalized communities, leading to unequal treatment and worse health outcomes. So what can we do about it? Here's 5 things. 1, implement comprehensive bias training programs. One of the most effective ways to combat medical biases is by implementing comprehensive bias training for healthcare providers. This training should go beyond surface level education to cover implicit bias, cultural competency, and structural racism. And let's face it, our current climate may resist this type of training, but history shows us that resistance has never stopped progress. So if you're serious about improving patient care, we must invest in regular, mandatory bias training to ensure providers can recognize and mitigate their biases. 2, standardized data collection on health disparities. Next, we need to talk about the data. You can't address what you don't measure. So standardizing data collection on health disparities is essential for identifying where gaps exist, which populations are most affected. Collecting data on social determinants of health like access to care, income, and education can lead to more targeted interventions. And by doing so, we address these disparities and create a roadmap for meaningful change. 3, foster diverse and inclusive work environments. Diversity in healthcare teams is not just a check in a box. It's essential for improving healthcare decisions and patient outcomes. Healthcare organizations must prioritize recruiting, retaining, and mentoring underserved groups in leadership positions. A diverse workforce, especially at the leadership level, better represents the population served and ensures that decisions are made with a broader, more inclusive perspective. We can't afford to have diversity in name only. We also need it to be done in action. 4, advocate for policy changes at the state and federal levels. Healthcare organizations have more power than they might realize when advocating for policy changes. Whether it's expanding Medicaid or pushing for legislation that tackles social determinants of health, such as housing and food security, advocacy matters. While working in health organizations, I saw how impactful advocacy can be. Your voice as a healthcare provider and organization is vital in policy changes and ensuring healthcare access. And 5, partner with community organizations. Finally, partnering with community organizations is one of the most overlooked but critical steps. These groups are deeply connected to the populations they served and can offer valuable insights. So whether that's through health education, outreach, or service delivery, partnerships with community organizations can enhance healthcare interventions and improve patient outcomes. Remember, community organizations are valuable allies. They deserve our respect and collaboration. But before we wrap up, here's a bonus tip. Start small, but think big. Even if you can't tackle all these recommendations at once, implementing just one can set you on the path to transformative change. For instance, starting with bias training in one department can ripple across your organization, and each step brings us closer to a healthcare system that works for everyone. Now that you know how critical it is to address medical biases, are you ready to take action? If so, book a consultation with me today to discuss how your healthcare organization can implement these strategies and improve patient outcomes. And together, we can create a more equitable healthcare system for all patients. Let's make healthcare better, one step at a time. Subscribe and hit the notification bell to stay up to date on our latest videos. And together, we can enhance Black women's health and create a better future for us all. Enhance Black women's health. Subscribe now.